Are you fascinated with neurology, interested in strokes and the whole stroke process and helping people to recover from strokes? Well, if so, then you might be interested in the specialty of vascular neurology. I'm talking to a PA today who gives us a glimpse into that specialty to let you see what it's like and also to help you decide whether it is a specialty that you might be interested in. Hi, it's Michelle with the Medicine Couch. Appreciate you being here. If you like this video, then hit the thumbs up and share it with colleagues and friends who might find it interesting. All right, let's go learn about vascular neurology.
I'm Allison Greenwood. I'm a vascular neurology PA out in the Midwest. It's great to be on the channel.
I am very happy to have you here. I'm excited to dive into this specialty. Like all of the specialties, when I talk to people, I always learn something new. So, tell us a little bit about your path from when you graduated as a PA. Did you
Mhm.
go straight into vascular neurology or did you do other things first?
Well, I actually started in hospital medicine. So I did a fellowship in hospital medicine after I graduated from PA school. So I did a year of training there. And that's actually where I got to be more familiar with neurology and stroke specific. And then I spent a couple of years in internal medicine, which was a wonderful experience, which then introduced me to neurology and then more subspecialty into vascular neurology.
And so the first question I think most people have, and it was the question I had when we first talked and first met, how is vascular neurology different than just straight up neurology or vascular surgery?
There's a lot of different roles that you can play in neurology. So a lot of people specialize inside neurology, so subspecialize. So vascular neurology is primarily going to be stroke, acute strokes in the hospital or follow-up strokes, and then other things. So there's going to be brain aneurysms, vessel malformations, dissections of the large vessels that go to the brain, really any vasculature inside the brain. Different than vascular surgery. Vascular surgery is a different role and different than neurosurgery. Those are the surgeons that are actually going inside, and that's not the same. But we
Okay.
work really closely with them all.
Now, is vascular neurology different than the stroke team that we hear about in hospitals?
No, vascular neurology is a lot of it is the stroke team. So it's the stroke doctor and typically one or two APCs that they work with that are the first ones they're meeting people at the door in the ER.
And I assume it's not all stroke, right? Do you have other conditions that you guys are seeing in that specialty?
Yeah, vascular neurology, I mean, the primary is going to be stroke, but it is stroke, transient ischemic attacks, TIAs. Aneurysms is another really big one that I see. Then some other kind of different things. There's a condition called moya, which is a vascular condition, a cerebrovascular condition, AV malformations or carotid dissections, RCVS, vasospasms. There can be quite a few different things, but the big bucket is going to be stroke.
So does that mean that in vascular neurology, you're always working inpatient, or is there a mixture of inpatient and outpatient?
Yeah, great question. I think that can look differently at different facilities. I initially started out as both inpatient and outpatient, and I focused on for inpatient as acute strokes. So people coming in with, stroke codes, running the stroke codes with the help of the vascular neurologist or the stroke MD, and making the decision for the tenecteplase or the treatment for acute strokes, and then following up with them in the hospital. And then on the outpatient setting, a lot of those patients that we see in the hospital, they follow up 4 to 6 weeks afterwards to just kind of go over their stroke, make sure they're on the right medications, and do more outpatient follow up. So I kind of had a hybrid of both of them. Things have changed a little bit. I'm primarily more just outpatient now, but I think it kind of varies where you're at.
So if you're inpatient, does that open you up to the same kind of schedule as all other kind of inpatient specialties? There could be night shifts, there could be day shifts, somebody's there 24/7, or is it still predominantly like a Monday through Friday daytime schedule if you're working inpatient?
How our facility is, it's Monday through Friday for all the APCs, and no weekends and no nights, which is wonderful. And for a lot of other areas with similar roles of me in different healthcare facilities, I don't think there's too much weekend or night calls, but that could be unique to the
Okay.
where I work. In our facility, the APC definitely helps with the acute strokes coming in, but there is the vascular MD that's there to help you too. And so in the after hours, it is on the vascular MD who does more of the night calls and the weekend shifts, and the APCs primarily just get to work the day shifts. So that's kind of a nice advantage of us. So
Some specialties tend to be like PA heavy, some tend to be NP heavy. What do you see in vascular neurology? Is it kind of a mix or do you see one dominate over the other usually?
it's a pretty total split, actually. It's pretty even, 50-50, I would say, even in the hospital and in the clinic setting.
What is your patient population like that you see? Is it predominantly elderly or do you see a mix? Like, and do you ever see any peds?
Yeah, great question. I don't see peds, so I see 18 years and older. The vast majority of the patients that I see are going to be above 60. But golly gee, I am seeing a lot more strokes at the younger age now. Late 20s, 30s, 40s is
Yeah.
becoming more common. But I would say that the big bulk of my patients are going to be 60, 65 plus.
I think as a population, we're generally getting more unhealthy. And so you think about heart attacks in younger people, but I never really even thought about strokes happening more and more with the age limit coming down.
The biggest thing is hypertension, high blood pressures. That's probably one of the bigger reasons why I'm seeing a lot more younger patients coming through. So, I mean,
Yeah.
there's other rare cases for why people have strokes, but that's probably the most predominant one that I'm seeing.
One thing that came to my mind is how the patients are coming to you because you're in an outpatient setting. Are they all referrals or are you ever seeing new patients or people just come in straight to you?
Mixed bag. So a lot of them are going to be the people that come in as those, acute strokes in the hospital. They were seen at our partner hospital, treated throughout the hospital stay, and then come and see me 4 to 6 weeks later. Again, primarily just to make sure we're on the right medications, blood pressures look good. A lot of times people are going to be on some dual antiplatelet therapy when we need to figure out when to stop it or if we should keep it going. So it's kind of just that continuum care, making sure we did the full workup and what other more advanced stroke workup we need to do. But a lot of times I get referrals from the primary care setting. So that will be if they're doing like an MRI for a different reason or doing a headache workout or something and they found an incidental stroke, or there's a suspicion for a TIA or stroke and they got it in the outpatient setting. So then I kind of start the full workup that was not done in the hospital, obviously, because it might be more of a stroke that's a couple weeks old. I get a lot of referrals again for incidental aneurysm findings, hearing
Yeah.
changes. We do an MRA, and I see a lot of incidental findings or old strokes and do the workup based on what's appropriate.
So a typical day, I assume in your kind of setting with the outpatients, it's more like a traditional outpatient thing. So could you talk about from like the hospital side mainly, like what is a typical day like for vascular neurology in a hospital?
Typically, those days are going to be at our facility 7 in the morning until about 3:30, where you're in the hospital, Monday through Friday, and you're going to be addressing all the stroke codes that come by. So if your stroke pager on, we are in a big metro hospital with a level 1 stroke center, so we get a lot of stroke codes. So you'll see probably several throughout the day, honestly. And then you also are following up on the patients that maybe have had the stroke the day prior or overnight, and you're following up on those consults. So there is a pretty good sized stroke team or neurology team, I guess, in our hospital, so we can kind of divide and conquer. But it can get pretty darn busy. So it's fun, it's fast paced, but it can get kind of tiring. There's a lot.
I think it used to be that the specialties were thought of that they had lower patient counts or maybe had a little bit more time to spend with the patients. But do you feel like in your specialty, it's becoming like every other part of medicine, like you have more patients than you have time?
Fortunately, they do allow the APCs to have a little bit more time with each of the patients, which is wonderful. So a lot of times we'll see the patient, and if we feel pretty good about the care plan, just see them individually without the MD following up on the patient in the hospital. At clinic is a little bit different setting, but in the hospital, I feel like as the APC, we get a good amount of time. If we have more questions, we want the MD to come see the patient, they'll come and see them. But that doesn't happen very often. And we have such a big stroke team that we can kind of divide and conquer. So yes, it's busy,
Yeah.
but with so many of us, yeah, we do a pretty good job of spreading it out.
And I was going to ask what your autonomy was like. So it
Mhm.
sounds pretty good. So you said it was a little different in outpatient. How does it work in your outpatient setting for autonomy?
Yeah. Well, outpatient, I'm completely independent. And, I have an MD that I can run cases through or look at the MRA with me to kind of help with questions that I'd have. And they're super supportive. But it's, my own patient panel. I have it pretty nice where I can see anything from 6 to 9 patients a day. And I get a good amount of time with my patients to educate them. So, I do feel pretty lucky that I get to talk about stroke, make sure they're on the right medications, and then even do some secondary prevention education with my nutrition background. I love to talk about nutrition, healthy lifestyle, diet stuff. So it really kind of hones into some of the other things that I really love about healthcare.
Patient education is important in any specialty, but I imagine that there are just a ton of things that you guys need to discuss because people's lives oftentimes are changed forever. And so you probably have a lot of education around that, but then also education on, like you said, diet and lifestyle, right?
Totally. Yeah. I mean, it starts with, why did you have the stroke? Let's look at the stroke. Let's look at the medications. Let's look at your MRI. And then let's figure out why. Let's figure out how to prevent another stroke. And then that's kind of the secondary prevention stuff. And then a lot of it is, well, what can I do now that I've had a stroke? So I'm hemiplegic. Can I drive again? Can I go back to work? Do I need to set up my house different? So it can be kind of long to cover all those things, but those are all super important, and that's why you have the help of your physical medicine and rehabilitation providers as well, who are down the hallway from us, that can kind of help address those other questions about driving and work and that stuff. So it's kind of nice.
Do you then have to make like disability determinations for people or make that decision whether they can or can't drive? Are you filling out disability paperwork for people? Is that part of your job?
Yep, that's a pretty big role. I will say again, I do share a lot of my patients with our PM&R providers, which they can kind of help with that stuff too. But yes, that is something that we do in this role. And for driving, most people get a driving eval if it's appropriate, and they go to our occupational therapy for driving eval. Then I make sure it's safe for them to get back. But that's pretty
Yeah.
common that I see in practice. The other thing too is like work rehabilitation. So hooking them up with returning to work. And if they can't do their actual job, like what are some other things that we can do that they can, with their deficits, what are some other jobs that may be fulfilling? So I kind of help set them up with the services appropriate for that too.
There's so many things in medicine, right? That we always think about the
Mhm.
medicine aspect, but there's so much psychosocial part to it. And I never put that together as that would be part of your job. I wonder also what procedures you do, if anything, in this specialty.
Not much. So this specialty,
Okay.
you don't do much procedures. Some people do Botox for spasticity with stroke, but again, that's more of our PMR physicians. No procedures really in this role. I guess nerve
Yeah.
blocks for headaches if they have some headaches with their stroke, but that's not very common. So
Is your facility set up where you have like physical therapy and occupational therapy kind of there with you, or are they all outpatient referrals?
they're all right there in the same building as us. We're a
Oh,
pretty
nice.
big center that we can send them right down to the floor of where the therapy is. So it's super nice, and they can come run up to our office and tell us how that person is doing. We're pretty interconnected between their groups, which is awesome.
I love that because it's so frustrating. I work in occupational medicine, and you send people
Sure.
out to physical therapy a lot, and you get a report every now and then, but it doesn't really. It's not like being able to talk face to face with a therapist and have the whole team like know this patient and
Yeah.
being aware of what's going on. So I love that. What things in this specialty have either been like a surprise to you or that you found that you really enjoy more than you ever thought you would?
Stroke is ever changing. I think people used to think stroke is just aspirin. Just give them an aspirin, give them a statin. I feel like that was kind of the thought process of stroke, but there's just so much more. There's so much different treatments. There are more medicines. There are more options. There's new imaging modalities that are so cool. I just got back from a big stroke conference last weekend, so I'm kind of fired up about all the new things. So that's kind of the exciting thing, is like all the new things coming out. Truly, the coolest thing is when you see a patient in a stroke code and they have a high stroke score, so meaning they have a lot of deficits, and then you're able to do the treatment. So they come in on time, in a timely manner. You're able to give the clot buster, you're able to suck up the clot, and their stroke score completely goes down to almost 1 or 2. So their deficits completely resolve, and then you see them in the clinic, and they walk into the clinic. Like, those are the cases that are just so cool. And I guess I didn't realize that I'd get almost emotional, because when you see them in that hospital and then when you see them in the clinic, it's just a cool thing to see. Something that
Yeah,
was
it must be
surprising.
vastly different. It's one of those conditions where it's night and day, like you can tell the obvious difference.
Yeah.
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 Anything else that you want to say about what's great about this specialty?
Specifically for where I'm at, my independence is really great. I do have a good supervising physician that I can ask questions to, and they can go through cases with me, and I can bounce ideas off of, and they're receptive to things that I have to say too. So we work really
Yeah.
well together, and I really love the relationship with the team that I have. Getting to know all the different specialties too, like the neurosurgery, the vascular surgeons, and neuro IR. Having that connection as a team is kind of cool too.
So definitely, I think if people want to be in this specialty, they probably need to be good or would like a team environment.
Definitely, yeah.
So every specialty has its downsides. What are some of the things that you think are challenges of this specialty or that
Mhm.
things people should really think hard about before they decide to get into vascular neurology?
So there can be paperwork, as we mentioned earlier. That is pretty common in this role, but you're going to find paperwork in a lot of places. I don't think you can
Yeah.
escape it. Um,
Yeah.
Stroke, although those stories are super rewarding, what I was saying with coming in with a stroke code and, rapidly improving, a lot of cases aren't like that. So it can be kind of emotionally draining. It is hard to hear those cases of the people who are younger having strokes and they are in a wheelchair so I think emotionally it can be a tough subspecialty. I do think you'll find that in a lot of specialties in medicine in general, but that one, I think that would be kind of the hardest thing about my job.
So you did like a hospital fellowship or residency, whatever you want to call it, when you were first kind of starting out. Was that something you would recommend to people? Fellowships just in general? Like, how do you think that that has impacted your career?
Funny you ask. We just started our new neurology fellowship for APCs, and
Oh,
it's been very
nice.
successful. But we've had one
Yeah.
round, but the fellowship was really good for me. It has helped me get where I'm at. So although I didn't stay in hospital medicine, so I did that year-long fellowship. It is designed for you to be in hospital medicine. It did open up all these relationships that I was saying. So it opened up my connection with neurology. It opened up my connection with the neurosurgery, neuro IR, and I got to meet all these other specialties through that year fellowship. In the fellowship, I got to do things that I did not get to do in PA school. They treat you kind of like a resident physician in the sense of you get to do some cool things that you probably didn't get to do as a PA student. The estimate is if you're doing these residencies or these fellowships, it is kind of like 3 years worth of clinical experience, is what they say. Again, helpful as a internal medicine provider, which then helped me even be a better stroke provider.
Right, because systems are connected. Things don't happen to people in a vacuum. You still have the whole rest of the patient that you're dealing with, and all the medications are on for other things. So having
Yeah.
that experience, I imagine, has been really helpful. And so you guys started your vascular residency or fellowship. Is that something you're involved with? Are you teaching, or did you help kind of make it happen?
And it's actually not just like stroke fellowship, it's a neurology fellowship. So it's all the things of neurology, which again is a lot. I can't take credit for being the lead of it, but I helped with the stroke component of it, the vascular neurology component of it. And I'm a preceptor for all the vascular neurology components. So I love it. And I think it's a good thing to have if you're going to get into neurology.
I'm sure that kind of shakes things up for you a little bit and gives you some new excitement or new energy or focus in your job. So I actually interviewed an ortho PA. They had a residency or fellowship program, and he's really taken it and expanded it. And he talks all about running it. I'll put that card for that video up here. So besides a fellowship or a residency in neurology or vascular neurology, what are some ways that you think people might be able to help prepare themselves to work in this specialty? Any other, resources or things you want to share?
Something that we actually have our residency candidates go through is it's through the American Academy of Neurology, so AAN, and they have a course for new grads, for people who've been in, an APC for 1 to 3 years, but neurology is new to them. They have an online course that you can take it at your own pace. The name is Neuro Ready, and it covers all the topics of neurology.
I'll put that link down below if people want to check that out. And what was this conference that you just went to?
Well, the conference was through Mayo Clinic, and it was all about vascular neurology, about all the new stuff about stroke, essentially. New treatment that we've been doing that we're confirming that we're still doing okay, and then all the new imaging that's coming through, or the really, really cool detailed imaging for stroke and aneurysms. So it was all designed for vascular neurology providers, doctors, APCs, nurses.
And how about any print resources? Is there anything that you keep on your desk that you refer to a lot, or you did when you first started?
There's some article, it's called Continuum. It's again for neurology specific, and it has a lot of good information. That is always the newest up-to-date stuff for anything neurology based. That can be a little pricey though, but as a neurology provider, that's a good resource to have.
For people who might be watching who are students or who are looking to go to PA school, if you can't get a vascular neurology rotation, because I imagine those are few and far between, or if you can't get like a straight up neurology or neurosurgery rotation, so outside of the neurology realm, what other rotations do you think would be helpful for students to have?
So I'd say hospital medicine. It's just the good in depth in all the body parts. And then honestly, cardiology. Cardiology is actually pretty helpful. Heart and brain is pretty darn connected. So knowing your cardiac anatomy and knowing the medications, heart specific medications too would be super beneficial. And hematology. I work with a lot of hematologists. Blood clotting disorders. Needing help with maybe some of the blood thinners too. So that actually would be pretty darn helpful too to know that background.
Yeah, I wouldn't have thought that, but that makes sense. Do you think that this specialty is new grad friendly? Like, do you think that this is something that people should or could come out of PA or NP school and go right into?
I think neurology as a whole would be kind of hard to do as a new grad. I definitely think doing a fellowship would be super beneficial. Vascular neurology, so being the stroke specific, again, that's really subspecialized. You are kind of in your little bucket. I think that could be a new grad friendly, pending on, again, it's going to vary everywhere you are, depending on your supervising physician and the training that you'll get through it. I would definitely would want you to have some good training because you are looking at a lot of images, and that takes somebody sitting with you, showing the images, going through it. That would be really hard to self teach.
Yeah, and this is a just good general thing for everyone to keep in mind, no matter if you're a new grad or a seasoned provider, and you're going to a new specialty. Some it is always good to find out what the team looks like, what kind of support you have, and what your onboarding and training is going to be. Like, what does that schedule look like? Because it is a nightmare to walk into a specialty and just be expected to know all about that specialty pretty much 1 week in.
Yeah, yeah, and like, and
Yeah,
then even like the subspecialties of knowing all the new up to date changes, the research. Like I said, stroke is ever changing, so I totally agree. It would be good to know
yeah,
what the training is, and asking for weeks of training, dedicated training, being supervised or being with that supervising position, and just kind of being their shadow, honestly. And that's what I
yeah.
did, which really did help me.
Great. Okay. Well, any last thoughts that you would give people who might be considering vascular neurology?
A super fun role. You get to, like I said, you get to make some pretty important decisions right away when you're seeing the person come in, and you can see some amazing results at the end. So I'd say it's a very rewarding position. It definitely comes with its challenges, and there can be some good days and bad days like any other role. But I would say overarching, it's very fun to know something really, really well.
If you are interested in neurology but not sure if vascular neurology is the right specialty for you, then check out these videos here. Thanks for joining me. And as always, take care, stay sane, and I'll see you next time on the medicine couch. Bye.